Buenos días. Ayer cerramos el primer día. Yesterday we closed the first day with Ali commenting on the IAPB energy. That is what keeps us together. There are three types of people. Those who 30% tend to be negative, 40% couldn't care less, and 30% have resilience, have a positive outlook. And that is what characterizes AIPB's members. We are all the resilient, and of those, we have a 1% who get up early in the morning on day 2 and are here first time in the morning to continue the flow into action, which is what we are called for in this Congress. Now, to keep that energy, Caroline, as president of IAPB, has honored those who are outstanding. Without recognition, we cannot keep that resilience going because it's easy to get a burnout.
Yep, very.
So she has done.
Well, okay, so thank you, Gloria, for that. I hope your earpiece is in. So this morning, we ended, amazingly with 3 of our young system leaders last night. And the feedback from all of you to hear their stories has been phenomenal. So you're going to meet our next 3 in a few minutes. But before that, we also would like to recognize the winners of our Posters Award. So remember, everything we see and everything we hear affects how we behave. And that's why the importance of campaigns and marketing and communications, the visuals to which we express what it is that we're passionate about, are hugely important. So it's no better way to start day 2 to keep the energy up and to keep me to stop dancing. It's very hot in this jumpsuit. We would like to invite our 4 poster awardees onto the stage, and I would like you to give them a massive big whoop. But I have to say this to you, you all know that I can't see very well and I can't read, but plus, Gloria, I can't pronounce the names. So will you do me a favor and you announce the names and invite our awardees onto the stage.
Impact Award, Sergio Latorre Arteaga, please come up.
Woohoo!
Congratulations. Visual Communications Award, Luis Andrés Ochoa Ramirez, welcome. The Host Region Award, Luz Elena Concha del Rio, please. And the People's Choice Award,
Drum roll,
Bruna Gil.
Drum roll, okay.
Bruna Gil Ferreira.
Now, I would like to ask our chairman, Mr. Baba Koresh, will you please come up here so we can take a photograph, thank you very much, with our Poster Award winners. Thank you very much. And congratulations, and thank you so much.
I don't know if you have gone through them. This is poster 24 for Impact Award.
Okay, so I'm going to ask you very briefly to tell me the inspiration behind your poster. Very briefly, we're going to do 30 seconds. Tell me.
My poster is about a protocol for school screening and treatment of children in São Paulo City. We are viewing 400,000 kids this year.
Thank you, and congratulations.
Yeah, we present evidence on the real-life health needs in school-age children in 12 countries, and it's just thanks to our partners that trust in us, and I hope it's going to be very meaningful for eye health globally.
Thank you so much, and congratulations.
We talk about the importance of teleophthalmology and that we can implement and invite everyone to implement teleophthalmology because it's a new and excited thing to do.
And a very quick way to scale. Thank you so much and congratulations.
We talk about the impact of socio-demographic characteristics in patients with inflammatory eye diseases.
Fantastic. So can I just give a round of applause? And Mr. Photographer, Thank you so much. Muchas gracias. Okay, Gloria, next piece of good news on our schedule.
Yes, we have the youth. Youth.
Okay.
Yesterday, you
on.
had 3 of our winners, please.
Okay, so this is the second of our young system leader stories. So we're going to sit down here, if that's okay, instead of standing. I am now going to invite up our next 3 from our fantastic 6 who are here present with us. It was wonderful to hear the stories yesterday, and I just want to acknowledge, would it be okay for me to say, we need to remember English isn't everybody's first language, and I just feel that needs to be said. So just let's be mindful that some people are not speaking in their first language. So, can I bring on to the stage, a drum roll please, for Arthur Brunt. Come on up, Arthur. Poonam. Michaela, come on up. Come on up. Michaela, over here. And lovely Poonam, where are you? Come on, don't be shy. Up you come, up you come. Oh, oh! Oh, oh! Okay, so as we did yesterday, of course I will not sit down, but anyway, as we did yesterday, I'm going to ask each of you to tell us a bit about who you are and why you're so passionate about the work you do and your role and what it is your organization is. And so Arthur, I'm going to start with you. So Poonam, can you pass?
Thank you so much. My name's Arthur, and thank you for having me and choosing me for this award. It's an incredible privilege. English is my first and only language, so I also have no excuse there. So my name is Arthur. I was originally a software engineer at Google, actually, with a plan to go more into the venture capital route. And then I met Jeffrey Tabin early in my life, and he was just so incredibly inspirational. Seeing the work that he did, and once I saw about the work that he did and learned about the work that you all do, there was really no other option than to try to follow a similar path. During a trip to Ghana, I met Akwesi Ahmed, who was the only vitreoretinal surgeon serving a catchment area of about 10 million patients, and that's a crazy ratio, and we wanted to do something about that. So we started a screening program to look at really the next set of diseases after you all fixed the problems for cataract and refractive and many of the other diseases. What are the other causes of blindness, and how can we start addressing those? And what we found was some of the big ones are diabetic retinopathy, sickle cell retinopathy, and then also retinopathy of prematurity. And we tried to build a telemedicine network to start scaling up screening and hopefully at one point be able to catch all of these patients and prevent blindness.
Now, you just told us everything you do, but 2 seconds. Why do you do the work?
I think for me, I ask the question of how can you not do the work? It's just once you see it, I don't know how you don't do it and choose other paths.
Thank you. Thank you, Arthur. That's a perfect answer. Yes. Poonam.
First, thank you, Caroline, for having me here. My name is Poonam Bhandari. I am working with this incredible organization named HCP Cure Blindness. And I would like to take this moment to thank IAPV for recognizing the work that I am doing for Nepal and Bhutan. And I would also like to express my sincere gratitude to HCP Cure Blindness and our leadership team, Katie and Josie right there. And thank you for empowering me, supporting me, and always trusting in me. And why I am doing this work is when it comes to work, I've always followed my heart. Either it's my previous organization working for a different sector, different humanist sector, or now in eye health. So I am always very, very happy to work for the people who are living in underserved areas of the world. And that's what I am doing. Either it is the old man living in the mountains, walking 5-6 hours just to get into the bus before he can get any primary eye care. Or it is the lady who is bilaterally blind and having to cook for her kids in the firewood. Or a kid who has the visual impairment, who doesn't even realize that he has it because we don't have that culture of vision screening in those mountains. So I feel incredibly motivated working for them, and that's what I'm doing, providing comprehensive care for them, comprehensive eye care. Thank you.
Thank you. Round of applause for Poonam. Michaela, who are you? Why do you do what you do? And what do you do?
Okay. Thank you, Caroline, for your words. Hello, everyone. Buenos dias, Mexico. I'm honored to be here and to be among the Young System Leaders 2024. And for that, my warmest appreciation for the IPB. I'm Micaela Reis from Portugal and Vice President of the Portuguese Association of Optometrists. As an optometrist providing eye care for children through screening and eye health literacy, it moves me especially. The reason why is very simple. Children are our future. I would like to point out that inmates and homeless people are a part of our community that is often neglected. That was a challenge having implemented comprehensive eye care programs to these people. I also leading a project with Portuguese disability associations to better understand the challenges they face and how we can better address them. And it's definitely an area that I'm passionately committed with.
Thank you, Michaela. You did brilliant. A round of applause for Michaela. Okay, so your hot question today is, if we want to achieve the strategy to end avoidable sight loss by 2030, what is it that you personally would do? And I'm going to start with you, Poonam.
That's a very, first of all,
it's a big question,
yeah.
But what would you
That's
do?
a big question, and then that's very, very ambitious goal to achieve by 2030. But I cannot just say one thing, so I would want to take two key things that we need to do today, because we're already in 2024, middle of 2024. So two things that I want to choose today is, first things first, so we all of us, we need to have this target and baseline data that is set for us. I know that most of the countries do not still have it. So that's the first thing that we have to do. Otherwise, we cannot just measure our progress or find the gaps where we need to work. And second thing is that we need to tackle with these barriers, especially the limited and limited care for the accessible and affordable services. And for that, what we need to do is we all need to work together. Governments, partners, we need to partner with each other, with the government, and with the partners from non-eye health sector as well. So because at this moment, I want to remember that eye health is not just a health issue, but the developmental issues, because that is impacting the job, education, and the quality of life. And how we can do it is we all need to work together to provide or strengthen the capacity building. We need to empower the local eye health professionals, and we also need to improve our existing infrastructure systems. And then we need to enable the patient care, and of course we cannot forget about the prevention programs. So if we all work together, then I see it's not very, very impossible to get in there by 2020.
Making impossible possible.
Yes.
Thank you, Poonam. Arthur, what about you? What are your thoughts?
Yeah, I think it's a very, very lofty goal, but
Yeah.
an important goal. There's a long tail of diseases that we'll need to address before we can hit this goal. Even if you look at Atherton, California, which is the wealthiest zip code in the entire world, there's a large number of patients that are blind in that zip code because they're 85 years old and have macular degeneration. So there's a lot of work that needs to be done across all spectrums. But what I think I'm most interested in is tackling, continuing to pick the lowest hanging fruit one by one and work our way all the way down that tail eventually, however long that takes. In Ghana specifically, we've learned so much just by asking the question of why are patients blind. For example, in the retina clinic, we found that sickle cell retinopathy is the #1 cause of blindness, even though this is typically considered to be a rare disease and a very poorly understood disease that hasn't had a randomized controlled trial since 1991. So we still don't know how to treat it, but it's probably the #1 cause of blindness, and it probably has good treatment options with laser and anti-VEGF. So I think doing additional research to make sure that we can find treatments that work for each specific patient population for the most common diseases, and then building programs to roll that out and screen and treat aggressively so that no one goes blind from diseases where we truly do have miracle treatments, of which there are many left to pick.
Thank you. Thank you, Arthur. Michaela, what about you?
We all know that millions of people around the world don't have access to glasses or any eye care. We also know that early intervention can prevent conditions including cataracts and glaucoma. Ending avoidable sight loss is an ambitious target, and there's a lot we need to do. So I would choose accessibility as a major barrier. By integrating eye care in primary health care, we can ensure that people having access to eye care in time and in their communities. So we know that distance is frequently a barrier to accessing to eye care. And for finish, ensuring accessibility for people with sight loss is just not an act of inclusion, but a crucial step towards building a world where everyone can live with equity, independence, and dignity.
Well done. Okay, you've got your 60. Can I just say, if we had 1,000 of you, what could we do? So I just want to thank all of you for coming and telling your stories, and for telling your stories maybe in not the easiest and most uncomfortable way. Takes courage. But to finish off, what are you looking most forward to today? Like, what are you looking forward to as we have this last day of our conference, other than dancing with me later? Because we are definitely dancing, people.
Yes, dancing.
Yeah, will you dance with me later?
Yes.
Okay, go. So what's the thing you're looking forward to?
Okay, it's wonderful to share all this knowledge with such brilliant and inspirational speakers. So I will inquire a lot, listen, and learn as much as I can. 2013 site provides all this amazing atmosphere and shared community with the varied topics of leadership, advocacy, campaigning, political strategies, and the developments needed for the 2030 goals. Shared community is essential to strengthening bonds, promoting mutual understanding, and inspired collective development. I could ask for a better opportunity to renew my motivation and redouble my dedication, hoping that I can live up to the level you all already brought it.
You are, and you will. Poonam, what are you looking forward to?
Today, so in this room here, we are all gathered. Like many from the government side, policymakers, many from the international organization who has this access to the resources. And then we also have the partners who are implementing projects in the ground. So today I am really looking forward to connect with you all and then utilize all the wealth of expertise and experience you have, and looking forward for loads of partnerships together.
Thank you, Poonam. Arthur, what's your...
Yeah, I look forward to just hearing as many talks as I can on what everyone has figured out for refraction and cataract screening services. These programs have been going on for decades, and the level of brilliance and discovery behind them is hard to appreciate sometimes because it seems so commonplace now. But I think so many things have been figured out for those diseases, and you all have come up with such cost-effective operations for those and have set the bar so incredibly high for the next set of diseases, for things like screening for glaucoma at a nationwide level, screening for sickle cell retinopathy, even screening for diabetic retinopathy. Good strides have been made there, but the bar for cataracts and refraction is so incredibly high, and I look forward to learning from you all so we can figure out how to tackle the next set of diseases.
Thank you so much, all three of you. So now we have the honor of giving you your awards. I wonder if Jess Beakers is in the room, if Jess is here. I can't see you, Jess, if you're here, but if you are here, stand and shout, because I just want to acknowledge the huge support and work that Jess... Is she there? Hi, babe! So I would really love to invite onto the stage our chairman, Baba Koresh, and our CEO, Peter Holland, to present our awards to our three wonderful young system leaders of 2024. Anna, will you come out as well? Okay, guys, let's come over here. Okay. Round of applause to our 2024 leaders. Thank you so much.